Hi, I'm Professor Muhammad Engin. Today, I would like to talk about breast thermography or breast mammography, thermal based. Now, this is chapter 1. Breast cancer is the leading cause of cancer death in the woman today. According to World Health Organization, in every 12 women have the risk of breast abnormality in her lifetime. It is well established that early diagnosis is very critical to increase survival rates. Unfortunately, 70% of the breast cancer cases are detected when the tumor size is over 30 millimeters. Therefore, there is a critical need for a method that can detect early stage breast cancer. Thermography is a method of cancer screening that has been known to detect early stage cancer. However, the lack of technical skill and expertise to interpret thermal images leads to this low diagnostic accuracy. Recent developments and high-resolution thermal cameras and computer algorithms for thermal analysis are making the interpretation process more factual. Hence, the thermal imaging along with computer-aided diagnostics is showing a promise of upgrading breast thermography to mainstream usage. Now, what is thermography? Infrared thermography is the recording of temperature distribution of body using infrared radiation emitted by the surface of that body at wavelength between 7 and 14 micrometers. With this information, it is possible to create a visual map or thermogram of the distribution of the temperatures and the surface of the object imaged. The sensitivity of modern infrared cameras is such that temperature differences to 25 Celsius of degrees can be detected. Thermography can be used to breast cancer screening based on the fact that the temperature of the tumor is about 2 Celsius higher than the neighboring tissues, and blood vessel activity surrounding the developing cancer is almost always higher than a normal breast tissue. Since breast tissue is a part of the skin, vascular alteration due to cancer result in temperature changes on the surface of the breast, which can be captured with infrared thermography. Thermal abnormalities identified with thermal images are among the early signs of precancerous or cancerous lesion of the breast. Thermal imaging is a non-contact, non-invasive, and extremely privacy aware. Since thermal cameras are small, they are very portable and can be used for screening in rural camps. Now, comparison with mammography. Most common methods used for cancer screening today is clinical examinations, mammography, and ultrasound systems. Among them, mammography is considered as a gold standard for breast cancer screening. It uses X-rays to screen the breast region and digitizes the density differences and image format. Some studies shows that it gives the sensitivity or statistical sensitivity of 68% to 88% and specificities ranging from 82% to 98%. In addition, it has the following disadvantages. The first one, low intensity towards younger women. The second one, a risk of radiation. Third one, fear and pain for some patients. And last one, patient's privacy. Thermography overcomes the above issues and enables more people to go for screening. It can work on women of all age groups. It is a non-contact, non-invasive modality with passive infrared instrument which doesn't involve any radiation. Hence a safe screening method. Among other modalities, clinical breast cancer exam can detect tumors only once they are large enough to palpable and result in many false positives. Effective use of sonomammography or ultrasonography for cancer detection requires location of the lamp. Hence, ultrasound the best use as a correlation modality. Once a lamp detected either flow mammography or thermography or clinical breast examination, ultrasound will be very useful to reconfirm malignancy or not. Now, what is the origin of cancer? Cancer cells release nitric oxides into the blood and they lead to alteration and microcirculation. This nitric oxide coupled with aggressive use of cancer to grow increases the blood circulation by dilating the vessels and it leads to creation of new blood vessels, namely neoangiogenesis. Large volume of the blood flow in these vessels connected to tumor makes them hotter when compared to normal blood vessels. This large flow distorts the vessel structure and vessels become dilated as well as elongated, causing the increase in dimensions of vessel caliber and length. In addition, it has been empirically observed that tumor temperatures is higher than the neighboring temperatures with the help of the contact temperature measurements. Aggressive use of cancer cells makes the boundary of tumor irregular as they breaks the boundary formed by basal laminas to invade the neighboring tissues. The size of the tumor indicates the stage of the cancer and largely affects the survival rates. Drastic decrease in survival rate with increase in the tumor size. Early detection of cancer increases the chances of survival. Thermography outperforms other modalities when it comes to early detection. Changes such as vasodilation, neoangiogenesis, or high tortuosity of blood vessels, which are found in initial stage of cancer, result on the thermal impressions, and his can be detected in the thermography. This might not be observed in other modalities, which depend on detecting architectural distortion that appear only when tumor sufficiently grow. Abnormality in thermograms, not the sole criterion for malignancy. Increase in head pattern might even be observed due to hormonal response, lactation, and the presence of the benign tumors such as fibrocystic and fibroadenoma. However, the scan malignant conditions had different projections in the thermography images when compared to malignant tumors. Unlike a malignant breast, where there is an asymmetrical heat map, heat response is mostly symmetrical across the two breasts with high hormonal responses. Estrogen release during hormonal activity produces nitric oxide that causes increase in heat and vessel dilations. Some recent explorations have shown that thermography can even help in progresses, since the increase of temperature in malignant tumors is primarily due to the release of nitric oxide, which is caused due to hormonal activity, temperature distribution, and the breast also provides signals and the hormonal receptor status of malignant tumors. Now, this title is Protocols for Capturing Thermal Images. Standard imaging protocol has been followed for any modality to make it repeatable and operator agnostic procedures that can reduce subjectivity and errors in image capture. Likewise, a set of instructions has to be followed in the thermography as well. Most importantly, before capturing the images, patient must be cooled for minimum period of 20 or 15 minutes in a room, maintain the temperature 16 to 22 degrees. This helps in attaining thermal equilibrium with surrounding environments. Cooling is mandatory. It is help in the removal of extraneous heat caused due to external reasons such as tight clothing, apparel, and friction from the handbag or outside temperature. Cooling also helps enhancing the temperature pattern of tumorous regions compared to non-tumor regions. It is observed that normal tissue reacts quickly to external cooling, whereas malignant reacts slowly, making it appear hotter compared to the rest of the breast region. For quick cooling of images, cold challenges can be used where patient hands are immersed in cold water, causing the regulation of body temperatures with sympathetic stimulus. When it comes to capturing the actual terminal images, imaging protocols can be categorized into discrete or continuous imaging ways. First one is discrete imaging protocols. And these protocols are interested in a specific set of static fixed views. The basic views which are observed in most discrete protocols include frontal view, oblique view, and lateral view. Some variations of different protocols in the way of the mentioned views are captured, such as seated position, supine position, standing position, and a combination of all. The second one, continuous imaging protocols. Continuous imaging protocols capture videos of the breast as they are called instead of static images. These protocols are not popular or discrete due to large processing time needed to analyze. However, much larger information can be captured in a video-based. Now, visual interpretation of thermal images. There are different protocols followed by thermographers for analyzing and interpreting thermal images, especially for breast cancer screening. Most of this work and creating the protocols have taken place in 1970s, 1980s, such as Marseille protocols, Hobbins protocol, Godery protocol, Hoekstra protocol, and more recently with newer thermal cameras, the Villa Mary protocol. An attempt to obtain an agreement of different experienced thermographers was also made in 1975 to provide a consistent set of observation to be noted. All these protocols give different thermography category rating of 4 to 5 levels starting from normal to high suspicious of malignancy. Multiple criteria are noted using both vascular and non-vascular observations. These criteria are generally qualitative rather than quantitative. This visual interpretation necessitates heuristic rules to combine these observations to determine the thermographic category. Some protocols assign numbers to each observation and combine them using a mathematical function for categorization. This also shows that the need for experience and proper training for thermographic interpretation. Regardless of variation across protocols, these criteria can be broadly classified into vascular and non-vascular criteria, with some generality in this criteria as follows. Figure 1 shows two thermal camera models for different vendors, Fuller and Mediterranean cameras. Non-vascular criteria. First one, focal increase in temperature by the fixed interval, for example, 1, 2, 3 degrees of Celsius. Second one, global increase in temperature compared to contralateral breast was, say, 1.5 degrees. Third one, regional increase in temperature, including specific quadrants. Next one, differences in temperature between contralateral regions or between different quadrants region at the same site. The next one, abnormal location of focal increase, including areolar regions or along edges, bulges. Last one, abnormal physical observations, bulging, size variation, retraction. Now, This is vascular criteria. First, vascular asymmetry. Second, vascular energy, including tortuous or serpentine, or loops or clusters of bifurcations. Third, increase vascular density. Next one, abnormal directions of cluster of vessels, such as vertical, horizontal, number of vessels, caliber of vessels, and last one, abnormal location of vascularity and avascularity. The general interpretation from these protocols is that with few and mild abnormal findings, the categorization is towards normal and likely benign. With increased abnormality, the observation tends toward increased suspicion of malignancy. Another important point to note is that benign disease also exhibits some abnormal thermal vascular, non-vascular criteria. The diagnosis of the benign conditions is made by follow-up to thermography over a few months, by which time the abnormal thermal findings change or reduce or disappear. Due to these multiple diverse metrics used by the practitioners and no standardized way of interpretation across different expert thermographers, the thermological interpretation becomes very subjective and many times result in high false positives. Many efforts are therefore underway to remove subjectivity using computer-aided diagnostic methods, some of which are described later. Now, advances in software technology. Visual observation and heuristic categorization are subject to human error and variation from subjective interpretation. To solve these problems, there are automated and semi-automated approaches for diagnostics. Some of the software tools available from companies who are intending to provide reproducible methods of interpreting thermal images. The technology used in three such software tools from RMI Health, Total Vision, and MammoVision, for example. All these approaches use static images obtained after cooling the subject with discrete imaging protocols. Visualization tool for thermal interpretation. Given that thermologist has to look at 5 colored images where the temperature differences between neighboring regions need to be identified by minute color variations, interpretation of thermal breast images is the huge cognitive overload and very error-prone. So, software tools that aid in visualization and capturing of the observation about thermal patterns are becoming available. Total Vision software from the Met.com gives an excellent visualization of the thermal images and additional support for a thermographer to systematically look for specific abnormal thermal pattern. MammoVision is a semi-automated tool that tries to identify the non-vascular abnormal thermal patterns during dynamic thermography with cold agency. It considered 10 images in total, 5 images before cooling and 5 images after cooling. Additionally, the clinician can manually identify the vascularity in the breast by looking at grayscale thermal image, which is then used by the tool to categorize the subject into 5 groups. The tool defines assessment criteria called Breast Infrared Assessment System, BRAS, namely, with which they categorize the images into 5 groups, with BRAS 1 being low risk and BRAS 5 being high risk. Now, use of the sophisticated computer-aided diagnostic. Use of sophisticated artificial intelligence algorithms For enabling automatic diagnosis or clinical interpretation, guidance is most needed to reduce subjectivity in interpretation. Niramai Thermalix software is one such advanced software tool with the technology that enables end-to-end full automated approaches for diagnostics. The Niramai tools uses complex computer algorithms for the following 5 key aspects of automated diagnostics. First aspect, auto-tagging. Since one single wave may not be sufficient to capture tumor region in different parts of the breast region, multiple waves are taken. Typically, there are 5 thermal images in multiple waves that are captured. One of the common mistakes done by clinicians is the name to image wrongly. It's observed that many of times humans are confused with classification of right and left sides of the breast in the image correctly and resulting in improper tagging of lateral or oblique views. Niramai software provides an automated tagging support. This reduces the error naming or fast tagging, which in turn will be resulted in the other errors such as segmentation error and misclassification of subject. This software automatically tags the waves based on the body border curvature and the body area. Second aspect is detecting the region of interest. The thermal image is captured with the patient sitting about 3 feet from the camera. This captures the thermal signature of the top part of the body of the subject starting from the neck region. A software tool like Niramai that does automatic analysis of breast cancer has to accurately crops of the region of interest, namely the breast tissue region. For this, the Niramai tool removes the inflammatory fold, axilla, sternum, and thyroid regions that are usually warm regions and they might unnecessarily cause false positives. Additionally, heuristic based on the shape of the body gives accurate segmentation of region of interest. The result shown in the figure. Now, figure 2, some segmentation result or from the multiple views, frontal, left oblique, right oblique, and left lateral, right lateral. The third aspect, tumor localization. Once the region of interest for analysis is determined, the next technical challenge is to accurately identify the exact location of abnormality or lesion. This usually means detecting region having warm and hot temperature pixels in the image and analyzing the heat pattern around the same. The heat patterns found in the thermal images are then analyzed for specific tumor properties. Tumor-specific patterns include multiple important thermal patterns or features that typically help in discriminating malignancy versus benign conditions. Symmetry plays a significant role in detecting whether hot patch is abnormal. So, a subset of region of interest showing the significant increase in the temperature as compared to the neighboring areas and contralateral side is identified. In Niramai software, the 2 varieties of abnormal regions are extracted. Niramai tools detect hot spots and warm spots in each wave of the subject. The base wave of the hot spots and warm spots are identified as the wave in which the normalized size of the detected abnormal regions with respect to region of interest is maximum. The figure 3 shows some breast thermal images for some conditions: hormonal sensitive tissue, lactating case, malignant case, benign case, and normal case. Fourth aspect is feature extraction. Once the hot or warm spot showing potential lesion is detected, three high-level properties of the lesion are extracted. These are boundary features, thermal symmetry, and temperature distribution. Malignant tumor cells are aggressive in the nature, which makes them to invade surrounding tissues by rupturing through the boundary formed by basal laminas. This makes the boundary irregular for malignant cases compared to non-malignant and benign cases, which behave similar to normal cells. In the case of the malignant tumors, benign tumors, inflammation, or wound healing cases, an increased temperature in the abnormal region is observed. This leads to differences in the thermal heat patterns compared to contralateral breast. However, similarity in thermal heat patterns is seen for normal hormonal lactated conditions. Due to presence of the similar hormone-sensitive tissues in the both breast, as shown figure 3. As I mentioned, the property is captured by including symmetrical features. Finally, the mean temperature differences between the detected abnormal region and the remaining region of interest is calculated to get the relative increase in temperature compared to the neighboring region. In addition, many other temperature parameters of the abnormal regions can be used for analysis. Last aspect, automated classification. Computer algorithms based on artificial intelligence and machine learning are making huge inroads in automated diagnostics. Many methods of supervised classifications are being developed where a small group of patient data is used to train a probabilistic model that represents the decision criteria based on the extracted features. Simple such classifier is a random forest that is able to identify the significant discriminatory features and learn combination of the features and feature groups of that helps decide on malignancy subjects. Other classifiers include support vector machines, k-means classifier, and deep learning methods. In the recent years, use of information technology in the healthcare diagnostics is proving to be very effective in improving efficiency and quality of care. Thermography is highly suited for breast cancer screening, owing to its ability to detect cancer much earlier than any other modality, patient safety, and privacy. The complexity and subjectivity in the interpretation of the thermal imaging has been a major deterrent in the wide acceptance of the usage of thermography. Use of the computer-aided diagnostics for automated thermography interpretation is just around the corner. With software support, thermal analysis and interpretation can be more efficient, effective, and non-subjective. Thank you. See you again. Bye.